It is evident that there are both similarities and differences between the health experience of Indigenous Australians and cold Australians. Similarities shared between both groups are that practical barriers faced to accessing health services. Accessibility may be limited to lower income earners or those living in rural and remote areas, due to the location of the health service centre not being easily accessible or centrally located. This may be compounded further by the cost of accessing services for those living in poverty or in lower income households, which then increases the isolation felt by the Indigenous and cold Australians. Another similarity faced is a lack of confidence to engage with services or provide personal information related to their health issues in fears that they may not be understood culturally, judged, or stereotyped, which can then see them disengage from the service because they do not consider it appropriate for their cultural needs, or they face issues in regards to fears that it may lead to a misdiagnosis. To that, there are many differences between the two groups. It is known that Indigenous Australians do experience much higher levels of illness and premature death than those who are non-Indigenous, including the cold groups. Indigenous Australians also face social expectations where they have much more of a higher disadvantage in regards to their behavioural and environmental risks. Culturally, they are also discriminated and judged, where their cultural identity feels as though that it has been taken away from them. Cold Australians are more recognised in professional qualifications and experiences. Generally, they tend to face greater language barriers, and they tend to also face barriers in regards to their new host countries, trying to familiarise themselves and be comfortable with their new homeland.